Hello dear friends, with you Yusuf Arafa, physical therapy student at Elibris University, Cairo, Egypt. Today we will discuss hip anatomy regarding its bones, muscles and ligaments and capsule. So let's get into it. The hip joint or ball and socket synovial diarthroidal joint. It serves as dynamic support for body weight, facilitating load transmission from trunk to lower body. It consists of two-thirds of a sphere, head of femur. Also, it consists of an acetabulum, which is the innermate. So let's discuss the general landmarks of the innermate bone. The innermate bone consists of three bones: ilium, ischium, and pubis. The ilium have an iliac crest, an ASIS anterior superior iliac spine, and anterior inferior iliac spine, and PSIS posterior superior iliac spine and posterior inferior iliac spine, and a greater sciatic notch. You guessed it, the sciatic nerve passes from here. So let's discuss the important landmarks in the pubis. The pelvis consists of two innominates, and these pelvis bones connects and come together at the pubic symphysis, here at this edge of the pubis. Also, there is a pubic crest and a pubic tubercle. We also need to note the acetabulum. The acetabulum serves as the socket that the ball of the femur gets into it and articulate with it. Also, we need to know that there is a labrum, increase the concavity and increase stability of the hip joint. There is also landmarks for the ischium. The ischium, you can pronounce it ischium or ischium. There are body of the ischium, ischial tuberosity, and lesser sciatic notch in the ischial spine. Also, there is a ramus of the ischium. Let's get into the femur. The femur, we will discuss the proximal end of it. The proximal end, this is the anterior view and this is the posterior view. So let's discuss the anterior view. This is the head, which we said that it is two-thirds of a sphere, and this is the neck, which displaces or get the motion away from, or the axis of rotation away, to decrease the force needed. Also, this will be discussed in the section and the lecture of the biomechanics. There is also the greater trochanter and the lesser trochanter. What is the importance of those? The greater trochanter serves as an insertion for the gluteal muscles. Also, the lesser trochanter is insertion for the iliopsoas muscles. So we will discuss the muscles of the hip joint. So first, we need to know the motions used or can be allowed in the hip joint. They are flexion and extension, abduction and adduction, external and internal rotation. So let's talk about the flexors of the hip joint. The flexors of the hip joint are psoas major, psoas minor, iliacus, pectineus, and the rectus femoris. So the first three muscles are called the iliopsoas muscle. So the rectus femoris is a part of the quadriceps muscles. So let's get into it. First, it's the psoas major muscle. It's acting flexion. Then this is the iliacus with the psoas major, and this is the psoas minor. The psoas minor is very small muscle, cannot perform hip flexion, but it can serve as trunk flexor. So this is the rectus femoris. The 3D gives us all the quadriceps muscle, but this the muscle that lightning with red is the rectus femoris only. And this is the pectineus. The pectineus is part of the adductors, but also it assists in the flexion. Let's talk about the extensors. The extensors are mainly the gluteus maximus, but also the hamstring muscles, including semitendinosus and semimembranosus, and the biceps femoris. Only the long head assist in the hip extension. Also the adductors. The adductors are the adductor magnus, adductor longus, adductor brevis, gracilis, and pectineus. So this is the adductor magnus acting adduction, and this is the adductor hiatus, which serves as a hole that the saphenous artery and vein passes from it. So this is the adductor longus, which from its name it's very long. It originates from the pubis, all the adductors, and insert in the adductor tubercle, this is the adductor magnus, and also insert in the linea aspera. The adductor brevis, I put it in a small because this is arrangement in descending order. So the adductor brevis is very small, it's from its name. Also the gracilis, insert in the base and serratus, acts as adduction. And also the pectineus, its main action is adduction. Let's talk about the adductors. The adductors is very important in our gait because it displays the ground action force away from the joint. So let's talk about the tensor fascia lata. It's an assistor, it's not a main actor. The main actor as an adductor is the gluteus medius. Also the gluteus maximus and especially its anterior fibers act as abductors. Let's talk about the internal and the external rotation. The internal rotators are the gluteus minimus and the tensor fasciae latae. So this is the tensor fasciae lata and this is the gluteus minimus. They are acting as internal rotators for the hip joint. Let's talk about the external rotators. The external rotators are mainly the deep muscles of the gluteal region. All of them, not all of them, it's usually they originate in the pelvis bone and inserts in the greater trochanter. The gluteus maximus is the only muscle, a superficial gluteal muscle, that acts as external rotator. So they are the deep muscles of the gluteal region acts as external rotators, and also the gluteus maximus muscle acts as external rotator. So we ended talking about the muscles. Let's talk about the ligaments and the capsule. First of all, the ligaments are forming the capsule of the hip joint. They are very important because they assumes and make sure there is a stability in the hip joint. There are three main ligaments in the hip joint. They are the iliofemoral ligament, which are called also the Y ligament. It is the strongest ligament in the body. It lies on the anterior aspect of the hip joint. Also, it prevents the hyperextension. The pubofemoral ligament is the number 2. It lies anterior-inferiorly. It prevents excessive abduction and extension. The ischiofemoral ligament is the weakest of the three. It consists of the triangular band of fibers that form the posterior hip joint capsule. It attaches to the ischium behind acetabular, attached to the base of the greater trochanter. Also, the ischiofemoral ligament prevents excessive extension. Let's talk about the ligamentous teres, or the head of femur ligament, or a ligament of the head of the femur. It's located intracapsular and attaches to the fovea of head of the femur. And also it carries fovea artery to supply the femoral head with blood in infants and the pediatric individuals. We also know that the blood supply to the femoral head in adults is negligible. I want to thank you watching this video, and I hope you find it very helpful. Thank you very much.